Hi, it's Dr. Amy Gearin, and one of the questions that we ask all of our patients when we do our exams is if they have ever been diagnosed with sleep apnea or if they snore. Most of the time when I ask that question, patients will laugh and say like, well, my wife says I snore, or my husband says I snore. And it's really funny because the spouses usually tell on each other. So there are a couple things that we can do here in the office to help you address that problem. First off, if you have been diagnosed with sleep apnea, we always encourage you that you work with your doctor to make sure that it's being treated properly and that you're getting the proper care to help address that. Sleep apnea can be very dangerous as far as your overall health, and we like to work with your doctor in that case. So we have a lot of patients that snore. One of the reasons is when we lay down, use my little model here. Here's your teeth. When we lay down, our lower jaw slides back like this, so that also our tongue and the soft tissue in the back of our throat collapses. That's your airway, and everybody's airway is different sizes. Some people are definitely more prone to snore, have sleep apnea, whether it's, from a upper, nose airway issue to down in the throat and the actual airway itself. So that when that happens, you get that loud noise when you're breathing and sleeping, and your spouse is like, roll over, and maybe even have to sleep in another room. So there's something that we can do with that. Also, if you have been diagnosed with sleep apnea and you find that you are struggling to be compliant with your CPAP machine, or if you have mild to moderate sleep apnea and you have not been recommended to wear a sleep apnea device, but you still feel like you're not getting that restful sleep, we do have a device and some treatment that we can recommend for you that is very helpful and beneficial. So there are a lot, probably hundreds of devices that have been designed by dentists and doctors to treat sleep apnea. They are recognized and approved by the FDA to treat mild to moderate sleep apnea or alleviate snoring symptoms. All of them kind of work the same way. They all work to, when you're sleeping, they work to help reposition that lower jaw forward and hold it in that place so that your tongue and the soft tissue open up that area so that you can sleep better. So the device that we recommend the most commonly here in the office is called an EMA appliance. We get a lot of compliance with that because it is more comfortable. It is very, and you can see maybe right there, it's less bulky than some of the others. It is like a clear retainer that fits on the top and the bottom, and then we have these little plastic bands that reposition that lower jaw forward. We get a lot of compliance and a lot of good results with this. These bands are different lengths. We kind of help you find which length is comfortable for you. There's a sweet spot between what's effective and what causes your jaw to feel a little bit uncomfortable. So we work with you to figure that out. We even can work with your doctor to help titrate that if you're using it to treat sleep apnea. And again, I encourage you to work with your physician if that is the case. But if you have any questions regarding snoring and sleep apnea, and if the device that we prescribe could be helpful for you, please give us a call, 702-367-4040. I know that a lot of patients that have used this, even just for snoring, they always come back and thank me later, or they lose their device, they need a new one, they go on a trip, they're like, oh my gosh, I forgot it when I went out of town, it was awful. They're just getting a lot more restful sleep. And spouses, I call it the spouse saver because, you can sleep in the same room, you're not being woken up. So there's a lot of things that this can help with. Just like I said, give us a call if you have any questions about it, and we would love to check out and see if you're a good candidate for it.